Let's discuss about an autoimmune disorder called as psoriasis. This psoriasis is an inflammatory condition that involves the skin and even the other tissues also. In case of psoriasis, we see the primary skin lesions like papules and plaques are seen, and many environmental and genetic factors are also involved as triggers for the development of psoriasis. Many genetic factors are involved, and even the environmental factors, even the infections, some of the infections found to be the triggers for the development of psoriasis. And I will just brief the triggering factors. Like the main triggering factors will be any infections seen in these patients, any group B beta hemolytic streptococcal infections, or winter periods also has found to be the triggering factors. Even substance abuse is also a triggering factor. Some of the drugs like lithium antimalarials also found to be the triggering factors for the development of psoriasis. And in case of psoriasis, even the joint involvement is also seen in case of as a complication, and the patient may develop psoriatic arthritis. In case of psoriasis, primary skin lesion will be the papules and plaques, and the definition is the chronic T-cell mediated inflammatory disease that involves skin and other systems. In case of psoriasis, we also see the systemic association, that is metabolic syndrome. Metabolic syndrome means hypertension, obesity, diabetes, and all comes under metabolic syndrome. And let's see the factors involved in the psoriasis. Cellular components are the Th1, Th17, Th22, subset of T cells are involved. Even the signaling molecules here is the cytokines. These conditions also called environmental and genetic factors. We see increase in pro-inflammatory cytokines seen in this condition. Genetic factors involved in the psoriasis are the HLA-CW6. In case of early onset psoriasis, HLA-B27 is also implicated. Let's see the triggers involved in the psoriasis. Triggering factors seen are the drugs like systemic steroids, lithium, even the antimalarials also can also trigger the development of psoriasis. And infections of group B beta hemolytic streptococci can trigger gutted psoriasis. And even this people have more recurrences or remissions. And other triggering factors are the winter and also substance abuse. And let's see the types of psoriasis present. The types of psoriasis include psoriasis vulgaris, gutted psoriasis, pustular psoriasis, erythrodermic psoriasis, and also scalp psoriasis and flexural psoriasis. Psoriasis is usually seen in the extensor surfaces. If it occurs in the flexural surfaces, we call it as inverse psoriasis. And the site mainly involved are the extensor surfaces. As I said earlier, the elbow and the knees are most commonly involved. Auspitz sign is seen where there is pinpoint bleeding sites are seen at the lesions, and Kobner's phenomena is also present. Kobner's phenomena is nothing but the development of new lesions at the site of trauma. And let's discuss about the nail changes seen in patients of psoriasis. Pitting of nails is seen. Subungual hyperkeratosis is seen. Even the salmon patch, that is a oil drop sign, which is the pathognomic of nail psoriasis, is also seen in patients of psoriasis. Let's discuss about the treatment options available. If the less than 10% body surface area is involved, then topical treatment is given. Phototherapy and systemic therapy is also offered to these patients. In case of phototherapy, we use narrowband UVB therapy, PUA therapy. Before giving the PUA treatment, first the patient has to be given Sorlins, and then UV rays has to be subjected to the patient. And the drugs which are used are the methotrexate along with folinic acid, cyclosporin, acitretin, apremilast are the drugs which are used in the treatment of psoriasis. And we need to keep it in mind that systemic steroids are usually contraindicated in patients of psoriasis, and the only indication where we use the systemic steroid is the pustular psoriasis of pregnancy, that is impetigo herpetiformis. And second drug of choice will be the cyclosporin in case of cyclosporin, and this cyclosporin is a very expensive drug. And this is in brief about the condition called psoriasis, which is associated with other autoimmune disorders also. And thank you for watching.